Welcome to this explainer. Today we're zeroing in on a pathogen that is basically a true geographical chameleon. It's a virus that acts like two entirely different diseases depending on where you're standing on the world map. It's a fascinating, if somewhat sobering, look at how an infection can manifest in wildly different ways across the globe.
So what virus completely changes its method of attack depending entirely on your continent? Seriously, if you caught the exact same family of virus in, say, Colorado versus Beijing, the way your body breaks down would be fundamentally different. The answer to this medical mystery? It's the hantavirus.
Here's our agenda for today to help us unpack this. First, the global hantavirus threat. Second, the Americas and HCPS risk. Third, Europe and Asia and HFRS. Fourth, diagnosis and treatment. And finally, prevention and protection. Let's jump right in.
Section 1. The global hantavirus threat, rodents, reservoirs, and risk.
Hantavirus is a zoonotic virus belonging to the family Hantaviridae. Now, what's incredibly interesting here is the relationship this virus has with its host. Each hantavirus is tied to a specific rodent species. The rodents carry it around, but they don't actually get sick. They're perfectly fine. But when humans accidentally come into contact with their urine, droppings, or saliva, well, we become the accidental and often very ill hosts. Now, no matter where you are in the world, the beginning of a hantavirus infection looks exactly the same. After exposure, the virus incubates quietly for about 1 to 8 weeks. Then, step 2 kicks in, the early universal symptoms. We're talking fever, headache, muscle aches, and some pretty rough gastrointestinal issues like abdominal pain and nausea. At this stage, honestly, it just feels like a really severe flu.
But here is where things get truly wild: the geographic split. What happens after those initial flu-like symptoms depends entirely on which hemisphere you call home. The virus basically hits a fork in the road, branching into two entirely different, very severe syndromes. We've got one path for the Americas and a totally different path for Europe and Asia.
Section 2. The Americas. HCPS risk. Low volume, high lethality. If you're in the Americas, hantavirus develops into HCPS, which stands for hantavirus cardiopulmonary syndrome. The virus rapidly and aggressively targets your lungs and your heart. Patients develop a cough and severe shortness of breath because fluid is literally accumulating inside the lungs, which eventually leads to cardiovascular shock.
The absolute most crucial point here is the lethality. While HCPS is actually pretty rare, we really only see a few hundred cases a year across the entire American continent, the case fatality rate is massive. It commonly sits between 20 and 40% and can reach all the way up to 50%. That's a coin toss. It's a disease of extreme public health concern just because of how deadly it is once contracted.
And there's this one bizarre and really dangerous exception to the normal rules. Usually, you can only get hantavirus directly from a rodent. But the World Health Organization has actually documented human-to-human transmission for the Andes virus. This is a specific type of hantavirus found primarily in Argentina and Chile. Now, it's limited to close, prolonged contacts, like household members, but it proves that this virus is absolutely capable of rewriting its own rules.
Section 3. Europe and Asia. HFRS. High volume, lower lethality.
Now, let's cross the globe. Over in Eurasia, the virus causes HFRS, hemorrhagic fever with renal syndrome. Just look at how different the target organs are compared to the Americas. Over here, the lungs are largely spared. Instead, the virus aggressively ravages the blood vessels and the kidneys. Patients suffer from low blood pressure, bleeding disorders, and ultimately, kidney failure.
But despite those incredibly severe-sounding symptoms, the case fatality rate for HFRS tells a totally different story. It ranges from less than 1% up to about 15%. Obviously still very serious, but significantly lower than that devastating 50% we just saw in the Americas.
And this brilliant paradox is really the core focus of our explainer today, how symptoms and risks vary so wildly just by region. In the Americas, you have HCPS attacking the heart and lungs with sheer lethality, but with very low volume, only hundreds of cases. Meanwhile, in Europe and Asia, you have HFRS attacking the kidneys and blood vessels. The lethality is much lower, but the volume is absolutely staggering, between 10,000 and over 100,000 cases annually, especially in places like China and the Republic of Korea. It's this classic trade-off between how easily the virus spreads versus how deadly it is to the host.
Section 4. Diagnosis and treatment. Racing the clock.
Diagnosing hantavirus early is, frankly, incredibly tricky. Because remember, those early symptoms perfectly mimic common, everyday febrile illnesses. The flu, COVID-19, dengue, you name it. Because of this, doctors really have to act like detectives. A detailed patient history is absolutely essential. Have they traveled? Have they been exposed to rodents? Or maybe done some recent forestry work? To actually confirm it, they have to rely on specific serological blood tests or molecular RT-PCR testing.
And we really can't understate the danger of those tests. Add this surprising and intense fact to your notes. Blood samples from suspected hantavirus patients are a severe biohazard risk. Laboratories must treat these non-inactivated samples under maximum biological containment conditions. They do not mess around with this pathogen.
Which brings us to a highly sobering reality. There is no licensed specific antiviral treatment. There is no vaccine. Whether a patient has HCPS in the Americas or HFRS in Asia, survival depends entirely on early supportive medical care. We can't cure the virus. We can only support the patient's respiratory, cardiac, and kidney functions, often in an intensive care unit, and just hope their body can fight it off.
Section 5. Prevention and Protection. Blocking the source.
So understanding your risk is the very first step. Certain everyday scenarios drastically increase a person's risk of inhaling the aerosolized virus. Cleaning enclosed, poorly ventilated spaces, like old sheds or cabins, is a classic risk factor. So is farming, forestry work, or simply sleeping in a dwelling where rodents have been nesting.
But the good news is you are absolutely empowered to protect yourself with a few highly specific, life-saving rules. Keep your homes clean, seal any building openings, and store food securely to keep those rodents out. And if you do happen to find an infestation, 2 rules are absolutely vital. First, you must dampen contaminated areas before cleaning them. Second, never, ever dry sweep or vacuum rodent droppings. Doing that kicks the viral particles straight into the air where you can breathe them right into your lungs. Just don't do it.
I also want to reassure you about healthcare settings. Even with that human-to-human risk of the Andes virus we talked about earlier, hospitals remain highly safe environments. The transmission risk in healthcare settings is very low, as long as standard infection prevention measures, like rigorous hand hygiene and proper environmental cleaning, are applied. And of course, specific airborne precautions are added for any high-risk aerosol-generating procedures. I want to conclude this explainer with a somewhat provocative thought. As human populations expand, we are pushing further and further into rodent habitats worldwide, altering the ecological dynamics of diseases. We currently have this fascinating, yet deadly geographical split: the lungs in the Americas, the kidneys in Eurasia. But as our climate and environments change, will the geographic destiny of hantavirus remain split, or is a global shift inevitable? Think about that as you process everything we've learned today.